Hello, everyone. My name is Alina Bonadonna, and I'm super delighted to see you all guys again at our next academy, which we actually missed one, unfortunately, due to sickness of our previous speaker. But right now we are here, and I'm super happy to welcome these two distinct professionals here, Sonia and Martin. Hello, guys. How are you?
Hi, I'm good, thank you. How are you?
Good. How are you, Sonia?
Yeah, all good here. Thank you, Alina.
Thank you, first of all, for joining us, for accepting my invite to give as much as possible value. And definitely, it's going to be a lot of value today during the session. And for me, in order not to take much time from our speakers, I would ask you guys very short, just give me some reactions so I know that you hear as well, see as well, and we can continue and start our presentation. Yeah, I see some reactions, and I'm super happy that people are joining, and they are reacting. So it's gonna be
Excellent.
really hot. So, Martin, Sonia, I'm just disappearing for a while to give you a stage, and then afterwards we will have QA session. So enjoy, everyone.
Thank you very much, Alina. Thank you, Sonia. So, hi everyone. Thanks very much for being here today, and to Alina and to Sonia as well, and for the invitation to speak today. I'm Martin D'Agostino, a food virologist and consultant, and today I'm focusing on the two main foodborne viruses of concern in the UK at the moment, which is norovirus, the most common cause of gastrointestinal foodborne illness in the UK, yet still unregulated, as well as foodborne hepatitis A virus. So I'm going to walk you through why there's a blind spot when it comes to dealing with these viruses and what the risks really look like and why it matters now more than ever. Just a little bit about myself. I've worked in the area of food microbiology and food virology for over 30 years, starting in dairy testing, then moving into PCR method development and virus research. And I've spent over 20 years in government laboratories on EU-funded food safety projects, and later became principal virologist at Camden BRI, where I helped develop the UK's first accredited method for detecting norovirus and hepatitis A virus in produce. Well, I now run virus safety, offer training and consultancy, and along the way, 2015 to 2022, I completed a PhD on norovirus in fresh produce. So I've been working in food virology for quite a while now, mainly looking at how viruses, including norovirus, hepatitis A and E viruses, get into the food chain and spread from farm to fork, and try to work out what we can do about it. Well, I've written and contributed to a fair number of papers and reports over the years, and it's nice to see that work being picked up and used by others in the field. But I'm also currently involved in a few international ISO committees, things like validating virus detection methods and
I
developing
do
standards
apologize,
for hepatitis
Martin,
B.
to distract you. Sorry, your slides are
Yes.
not showing now. Yeah,
Oh,
yeah,
I'm not
yeah,
showing.
yeah. Not showing. Yeah, that's all fine. We are not yet that far. So,
Oh, goodness. Don't know what's happened there.
yeah, now it's all perfect.
Is that better? Oh, sorry about that.
It's okay.
Okay, we're good. Okay, so I've already introduced myself, who I am there, but we're all good now. Okay. Um, So yes, so I'm involved in practical and policy side of things, and through viral safety, I work with businesses and regulators, helping raise awareness and improve control measures for viruses in food. And that's really my goal now, is to keep raising awarenesses of foodborne virus risks in an area where regulatory environment they remain excluded from monitoring and control policies. I've also recently partnered up with Ask Sonia and the Chartered Institute of Environmental Health, where my training courses can also be booked through as well. So I just wanted to open up with this quote by Sir Peter Medawar, who's a Nobel Prize-winning British biologist. who once described viruses as a piece of nucleic acid surrounded by bad news. And I think that kind of captures the essence of viruses pretty well. They're incredibly small, but they can cause a huge amount of disruption, especially when they enter the food chain. And unlike bacteria, viruses don't grow in food. They don't make it look or smell any different, and most survive chilling, freezing, and even some mild heat. So we often don't get to know if they're there until people start getting ill. Today's session is about understanding those viral risks, especially norovirus and hepatitis A, and what practical steps the food industry might be able to take to prevent them. So let's move on. So here's a question I want you to think about as we progress through the presentation today. Roughly, how many people do you think could be infected by the amount of norovirus that could fit on the head of a single pin? We'll just hold that thought as we go through the next few slides, because when you see how tiny the virus is and how small the infectious dose is and how easily it spreads, you might start wondering the same thing that I do. Why isn't this taken more seriously when it comes to food safety regulations? If you want to take a guess at the number, please feel free to pop it in the chat and you see how we see the answer at the end of the presentation. Have a guess. So these are some of the typical things that I hear when foodborne viruses come up in food safety discussions, and they might help explain why the issue doesn't get the attention that it should. The idea that foodborne viruses only cause mild illness, for example, tends to downplay the seriousness of their impact, and that perception can unfortunately carry right through to policy decisions. Relying on E. coli testing as a hygiene catch-all is another one. It may give some reassurance, but it tells us nothing about whether viruses are present or not. There's also a lot of uncertainty around the interpretation of virus detection, the molecular detection methods, particularly the assumption that if you detect a virus, it's probably not infectious. Well, that's often used to justify a lack of action. And finally, assuming a quick rinse under the tap is enough to deal with viruses on produce just isn't supported by the evidence, but it's still a very common belief. So even before we get to the science and the regulations, these kinds of misconceptions shape how seriously the issue is taken or not taken, as the case might be. So before we get into the details about norovirus and hepatitis A virus, it's probably just worth saying right now that they're obviously not the only viruses that can be transmitted through food. Hepatitis E virus, sapovirus, rotavirus, and adenoviruses have all been linked to foodborne illness in various settings. But norovirus is by far the most common and arguably the most disruptive in terms of both the number of cases and the practical challenges it creates for the food industry and public health as a whole. So in this section, I'll focus on what norovirus is, how it behaves, and why it's such a problem, particularly in relation to things like fresh produce and ready-to-eat foods. So where did it come from? Well, norovirus was first discovered during an outbreak at an elementary school in Norwalk, Ohio, way back in 1968. They didn't know what it was that caused that outbreak, but it wasn't actually identified until 4 years later, in 1972, when the man you see here in the middle, Dr. Albert Kapikian, who played a key role in that discovery, was able to find it using immune electron microscopy. Since then, it's gone by lots of different names. It's gone by a name like the winter vomiting bug, viral gastroenteritis, stomach flu, none of which really quite capture how infectious and disruptive it actually is. You might also hear a thing called Norwalk virus from where it was discovered. And in terms of symptoms, it's very fast acting. If any of you have had it, you'll know, because you can get very unpleasant symptoms, very sudden onset of projectile vomiting. You can get diarrhea along with that. You can get stomach cramps, dehydration, and general feeling of malaise. And the onset can be really sudden, and it spreads extremely easily. But despite decades of research, there's still no vaccine norovirus, although work is actually ongoing at the moment to develop one by various groups. So what about its size? Well, this is where it really matters. Small, around 30 nanometers in size. That's about 100 times smaller than an E. coli cell, and absolutely tiny compared to a human cell, like a red blood cell that's up in the left-hand corner there. In fact, you could fit around 30,000 norovirus particles inside a single E. coli bacterium, and that really shows how densely they can be packed into a small space. And what's more, the infectious dose is estimated to be very small. As few as 18 virus particles might be enough to cause illness, with the average being around 100. So because of their size, norovirus particles can pass through filters designed to block bacteria, which means standard filtration systems are probably not going to be very effective against them at all. So it's not just that it's small, it's that its small size has very practical consequences as well for contamination control. Now, when we talk about viruses on fresh produce, one of the key challenges is the surface of the food itself. Things like blueberries and raspberries and strawberries all may look relatively smooth, but of course, it's not. They can be incredibly complex at a microscopic level, where viruses can enter the system of it. So viruses like norovirus can form strong electrostatic bonds to the surfaces of the fruit, which make them very hard to remove, especially by simple washing procedures. And these images show just how varied and textured these surfaces can be. So you've got a strawberry seed there, a raspberry surface, and a close-up of a lettuce leaf showing the stomata there. And each of those areas can easily trap virus particles. In fact, the scale that these are at, you probably wouldn't even be able to visualize the virus particles on there because they'd be so small you wouldn't be able to see them. So the structure of the food itself can actually really help to detect the virus and in turn result in standard cleaning or washing methods being much less effective. So the food itself, of course, can be a physical barrier to control measures. And it's part of the reason why fresh produce is such a common vehicle for foodborne virus contamination. But you might be thinking, well, how do they actually get onto the surfaces of food in the first place? Food chains that have been directly implicated in outbreaks of foodborne viruses, and each of these has its own risk points. Fresh produce, which we've just mentioned there, is probably the most major one, especially leafy greens, soft berry fruits and bulb vegetables. So contamination can occur through contaminated handlers' hands, contaminated irrigation water, or even contaminated water which is used to prepare pesticides. Frozen berries have also been linked to several international outbreaks. Again, contamination can occur through handling, through water, or post-harvest processing. Shellfish are probably the most well-recognized transmission route because they can filter and concentrate viruses from contaminated growing waters. In fact, an oyster, I believe, can filter about 190 litres of water per day. So if you think if that water is polluted, the virus gets concentrated within the digestive system of the shellfish, and that virus can remain in there until it's eaten. And perhaps while less often talked about, pork products are another potential route, particularly for hepatitis E virus that I mentioned earlier. I'm not going to go into too much about hepatitis E virus here, but in terms of fresh produce, infected pigs can actually shed the virus on the farm, which can then enter the watercourses and even end up being potentially in irrigation water. So the risk isn't just from poor hygiene during food preparation like many people think. It can occur right along the supply chain from farm to fork. And actually the production stage is the one that is the highest risk for contamination of fresh and frozen produce usually before HACCP systems kick in. Well, how is it transmitted? Well, really, norovirus can spread anywhere where infected people come into contact with food or surfaces or indeed other people. From production and preparation areas to raw ingredients, baked goods, touchscreen technologies, there's nowhere that's immune from the risk of, a workplace at risk of being contaminated. Uh, Offices, your home, your family, anywhere really where there's other people around that could be contaminated or have the infection. Asymptomatic food handlers are a real risk because there's obviously no visible signs of illness, so standard illness protocols aren't triggered. And the virus can survive on different types of surfaces for days, depending on which surface it is. Routine cleaning that isn't specifically designed to tackle norovirus may actually help to spread it. So controlling transmission means thinking beyond just visible hygiene issues and really having to consider the characteristics of viruses which make them so different from bacteria. So let's have a think now about the societal burden of norovirus. It's really one of those pathogens that tends to fly under the radar. It's often dismissed as just a mild, short-lived illness, which for most people it is, but when you zoom out, the impact is anything but minor. This isn't just about, what you hear about, like hospital wards being closed for a few days, although obviously you wouldn't want to be a patient in hospital and have norovirus. That must be horrendous. But we also see disruption across schools, across care homes, across food businesses and workplaces. Norovirus doesn't just make people sick, it causes widespread operational and financial disruption as well. And the effects can often ripple far beyond the individual cases. Well, this chart here that I put up is derived from the UK Food Standards Agency report on foodborne disease policy, and it shows the estimated annual societal cost of different foodborne pathogens in the UK. I've only got a few there, but in the report they've got about, I think it's 13 pathogens. And right at the top is norovirus, costing an estimated £1.9 billion per year to the UK economy. Now that's more than double the cost of Campylobacter and far higher than that of Salmonella, Listeria and Campylobacter combined. But despite that, norovirus still doesn't feature regularly or prominently in most food safety discussions. And part of the reason is that we're not routinely testing for it, we're not monitoring for it, so it can slip under the radar. So obviously, if you don't detect it, we don't report it. And if it's not reported, it's much easier to dismiss as less of a problem than it really is. Norovirus doesn't just top the chart in terms of cost, though. It also leads in the number of foodborne related deaths each year in the UK. Again, this is based on FSA data. Now, to be clear, Listeria, for example, obviously has a much higher case fatality rate. You can see these case fatality rates in the left-hand chart there. And you can see Listeria has a case fatality rate of 16.05%, which is very high. So when it comes to causing illness, it's very serious. That's not in question here at all. But norovirus causes far more illness overall, and that translates into more deaths more often. And what's striking here is, if you look on the right-hand side, is that norovirus is the only pathogen on this list that isn't subject to any legal threshold or microbiological criteria. And while risk policy is very often driven by statistics such as cost-benefit models, case fatality rates like we see here, proportion-based actions, etc., the impact of those 56 lives lost to norovirus each year doesn't show up emotionally in the data at all, but it's still 56 people, and that should matter. We regulate pathogens with far fewer deaths. The fact that norovirus still isn't part of that regulatory framework is a serious blind spot. Well, virus detection, while it is technically challenging, it can actually be very robust when it's done properly. And even though we can lose a large proportion of the virus during sample analysis, it has helped in being able to provide data which the FSA has used to calculate those estimates I gave earlier. The FSA's scientific review published in 2020 incorporated prevalence data from fresh and frozen produce sold at retail in the UK based on sampling and analysis performed in the years 2015 to 2016. Using improved modelling methods, they revised the total number of foodborne illness cases in the UK to around 2.4 million per year, which is more than double the previous estimate of 1 million. And within that, norovirus had the highest estimate of all the pathogens, with 383,000 foodborne cases annually. This was estimated from data during a year, interestingly, which was a low prevalence year in the community for norovirus. So it'd be interesting to know what the figures would be if that was done today. Well, that's up from just 73,000 in the 2009 estimate, not because the risk suddenly changed, but because we're now measuring it better and have the prevalence data to back that up. And when you break it down, it's not just about oysters or berries. In fact, those only make up 3 and 4% of the estimated cases, respectively. Most of the burden comes from much more common routes. 37% of cases linked to eating out, 30%, which is very large, to the consumption of lettuce sold at retail, and 26% to takeaways. So really, this is a widespread issue, often involving everyday foods, and much of it is happening quietly without being detected or reported. Well, let's have a look at a real-world example of how norovirus can cause a major outbreak through food. And I've just highlighted one here. There's many I could highlight, but this is one of the biggest ones that's ever been recorded. In 2012, Germany reported around 11,000 cases of gastroenteritis linked to deep frozen strawberries imported from China. These were served in school and childcare settings across 5 states and 390 institutions. The exact cause of contamination was never identified, and that really highlights how difficult it can be to trace viruses in long and complex supply chains. But in response, the EU introduced a mandate that 5% of Chinese strawberry imports must be tested, a clear case where a foodborne outbreak directly influenced policy, and this has happened on a couple of occasions since then. What's interesting here is that case control studies linked the illnesses to a dish, a strawberry compote, which was served cold in school canteens. No heating was applied, no kill step was performed. But interestingly, there was also a social science angle to this as well. At the time, there were real pressures to keep school meal costs down. Some reports suggested budgets as low as 50 cents per meal once overheads were taken out. So bulk buying frozen food from China looked like a very smart cost-saving strategy, but what we ended up with was a cold product served straight to children without any process step that would inactivate norovirus. And it's a real stark example of how procurement decisions driven by budgets can have unintended food safety consequences if viruses aren't factored into the potential risks. Now in the UK, there's a well-known Mexican restaurant chain called Oaxaca, and this was hit by a very big norovirus outbreak, and it's a very good example of how things can go wrong at scale. There was over 1,000 people involved in this one. And this is when a new ingredient was introduced to a tasting menu. So in this case, the suspect was although it wasn't confirmed, but the suspect was a chipotle chili ingredient used in a dish launched across all Oaxaca restaurants at the same time. And it turned out that the ingredient came from a new supplier, and crucially, it was added late in the cooking process, so there was no real heating step to inactivate any virus that might have been present. That meant if it was contaminated at source, the virus went straight onto people's plates. So while this wasn't a classic case again of poor hygiene in the kitchen, it's a reminder that ingredient sourcing, handling and cooking processes all matter, especially when you've got multiple sites and new recipes being rolled out nationally. The fallout was huge. As I say, over 1,000 people affected across 18 branches in the UK, with 9 having to temporarily shut. There were also legal and compensation costs, and all this was from a single contaminated ingredient that slipped through the net. It really had a profound impact on Oaxaca's business practices. Mark Selby, the co-founder, stated that it fundamentally changed how they operated. They ended up having to demand full transparency from their suppliers to ensure food safety was top priority. At one point, they even considered closing all their restaurants for 4 weeks. Their financial impact was huge. Sales dropped by 45%, and they faced a £4.7 million loss that year, compared to a £600,000 profit the previous year. So this experience really illustrates how severe foodborne outbreaks can force companies to rethink supply chain transparency and quality control to safeguard both public health and business sustainability. But the Oaxaca norovirus outbreak also had serious individual health impacts, leading to legal action in one case. This is where it's important to look beyond statistics and numbers and just say it's just a mild illness, because it's not always the case. Law firm Irwin Mitchell represented affected diners seeking compensation following Oaxaca's admission of liability. Now, in one case, the 16-year-old girl, Sarah Cousins, who has type 1 diabetes, became severely ill after visiting Oaxaca, even developing ketoacidosis and needing hospital treatment. And this case really highlighted the potential for serious complications in vulnerable individuals, as noted by Irwin Mitchell, who really emphasised the need to prevent future incidents. So Sarah's story really reminds us of the lasting impact of foodborne illnesses on individuals, especially those with pre-existing conditions. So just stepping back for a moment, this outbreak didn't just impact diners, it had huge business consequences. £5 million losses, which is staggering, but just as damaging was the hit to their reputation. The press and social media was all over it, and even now many people still associate Oaxaca with this incident. What it really exposed was how vulnerable supply chains can be, especially if ingredients are coming from outside the UK. In this case, the ingredient came from a new supplier and was added at a late stage, meaning no kill step was introduced. And actually, no UK-based testing would have been able to pick it up anyway, as it's not a typical item that would be tested and lies outside the scope of the type of sample that can be tested using the current standard detection methods. So it really showed that we don't really have a proper system in place for testing imported foods for virus, especially ingredients like dried herbs or spices, which can be very tricky to work with in the laboratory. So overall, this wasn't just a hygiene issue. It's a reminder that virus risks can emerge from complex supply chains that we don't even think about. And if we don't ask the right questions or have monitoring in place, we may not catch it until it's too late. Most of these outbreaks occur, and it's very often just a reactive response. There's really no proactive stuff going on. So let's just move on now very briefly to hepatitis A virus. This slide sets the scene for understanding what hepatitis A is. Hepat refers to obviously the liver, and itis meaning inflammation, so it's inflammation of the liver. And this virus was first identified back in 1973 by a Dr. Stephen Finestone, along with colleagues. And before that, what we now know as hepatitis A was just lumped together with other types of liver inflammation and was simply called infectious hepatitis. And it was really only distinguished from hepatitis B at the time, or serum hepatitis, by looking at how it spread and who it affected. Well, why does this matter? Well, because that particular discovery really shifted how we think about viruses that spread through the fecal-oral route, including their role in foodborne outbreaks. And it also gave us the tools to start tracing and controlling those risks much more effectively. So as you can see from this slide, hepatitis A virus is very similar in size to norovirus, but perhaps the biggest difference is the incubation period, which is much longer. It can take about 50 days incubation period. So it's much more difficult to trace back foods that might have been eaten that were contaminated. And also the symptoms and the illness can last for weeks to months, potentially. Most people will get over it fine, but there's always some cases where you don't do much. So yes, hepatitis A vaccine, of course, is available, but it's not routinely provided to food handlers, although they are actually trying to change that in the US because they've got a big problem with hepatitis A in the US. So has it caused problems? Well, yes, it has. It has caused problems in the UK a couple of times now. From January to April 2021, there was a big outbreak. England and Wales experienced a hepatitis A outbreak linked to medjool dates. This outbreak resulted in 31 confirmed cases, with several individuals hospitalised. Notably, none of the patients had a travel history, which meant it pointed to a local source of infection. Epidemiological and microbiological investigations confirmed dates as that source, although the exact confirmation source of why they were contaminated wasn't reported. Public health authorities issued a recall for the implicated batches, but unfortunately the outbreak occurred during Ramadan, a month where date consumption traditionally increases among the Muslim community. And it was thought that washing dates were suggested as, a potential control measure, but that was deemed ineffective for preventing this specific contamination. No one really washes dates as a sort of control measure here. And hepatitis A, is still in the current state of play at the moment. The latest information I have is that there's still a couple of outbreak clusters being investigated. That was from April this year. I don't have any updates on this, I'm afraid. So there might be something in the official websites, the government websites, to say what happened soon, but I don't have anything else other than this. But as you will see, they have had a high hospitalisation rate, 66% hospitalised in that first cluster. Thankfully, no deaths were recorded. But unfortunately, it hasn't really been made public what food item was considered to be contaminated or which retailer it was being sold from. This is a big problem when it comes to things like norovirus outbreaks and hepatitis outbreaks. The public don't really tend to hear much, apart from if it's in a newspaper, if it's been reported on. But really, this is a real blind spot, because if it's a frozen product, which a lot of these things are, customers may still have the suspected food item in their freezers and be unaware of what the food stuff is, or to get rid of it unless there's an actual recall. I don't believe that was done in this particular instance. So coming to the question then, why is there no regulations in place or microbiological criteria in place if these viruses cause so much of a health burden? This is one of the most common arguments used to explain lack of regulation for norovirus in food. That when we do detect it on food, we're probably just detecting little bits of the RNA, because we're just detecting the small genomic parts, and it probably isn't infectious. But the truth is, we don't know that if we get a positive detection of norovirus using molecular methods. It could just as easily be intact infectious virus that we're detecting, especially on foods like lettuce or strawberries, where there's no kill step introduced, and norovirus is known to be far tougher than most bacterial pathogens are. So we have to ask ourselves, where is it coming from? Norovirus doesn't come from the soil or water like many other bacteria do, like E. coli and Salmonella and Listeria. They're not naturally in the environment. It comes from the human gut alone. Hepatitis E obviously comes from pigs, but norovirus and hepatitis A comes from the human gut. So if we're detecting it on food, that means fecal contamination Somewhere in the process has occurred at some point in that food supply chain. Plus, the ISO method for detection allows for up to a 99% loss of virus during testing. So if you do get a positive detection, even a very faint one, it likely started at much higher numbers. And that's really a potential hygiene breach. Dismissing it as harmless without proof risks letting serious contamination go unchecked. Now, the next argument is that most norovirus cases are person to person. And while that's statistically true in terms of total transmission routes, it can sometimes lead to foodborne cases being deprioritized. But these two routes aren't competing for importance, rather they coexist and they often interact. From a risk assessment perspective, person-to-person transmission is often easier to quantify through outbreak data and healthcare surveillance. Foodborne transmission, by contrast, is much harder to trace and confirm, especially without routine monitoring in place. So what happens is foodborne risk gets under-recognised, not necessarily because it's less important, but because the evidence base is much patchier. The concern is that we risk creating a kind of circular logic. Because we're not routinely measuring foodborne exposure, the evidence base stays small, which then reinforces the idea that it's a minor route. But the FSA's own figures show otherwise. Foodborne norovirus cases alone are estimated to exceed those of all the major bacterial pathogens combined. So while person-to-person is absolutely a big part of the picture, it shouldn't be used to eclipse the very real foodborne risk. We're not arguing about the size of the pie here, we're trying to fix that one contaminated slice of it. And the last point is quite interesting because the updated modelling of the estimates doesn't necessarily mean that norovirus is suddenly a bigger problem than we thought, but it tells us that we now understand its contribution to foodborne illness better than ever. So whilst the perception is that the risk hasn't changed, our ability to measure it has. And that therefore begs the question, at what point do we decide that a better understanding of the risks should lead to better control strategies? What further data is needed before control criteria are put in place? Interestingly, norovirus is now notifiable in England, not in terms of foodborne detection, but clinically. So if a clinical lab detects it in a stool sample, they must report it to the UK HSA within 7 days. That's a big step forward for public health. But in food law, there's still no thresholds, no limits, no standard set. Unless it's shellfish, which does have EU-derived regulations based on E. coli levels as a proxy for norovirus risk. But there's no legal action required if norovirus is found in lettuce or berries or whatever. So even if you detect it, there's no clear route for action unless there's a voluntary recall considered by the retailer. So there's the gap. Norovirus is recognised as a serious, highly infectious virus. New variants like norovirus G27T are emerging in the UK now, but the food safety framework hasn't caught up with what we now know regarding its prevalence, health and financial burden. And I don't know if you've seen it, but that Netflix documentary, which is excellent, really said it perfectly. The congresswoman there said, if it can make people sick, regulate it. So right now, norovirus, being the #1 cause of foodborne gastrointestinal illness in the UK, is most definitely the exception. Another interesting point to highlight is that the third intestinal infectious disease study in the UK is well underway, and it's already giving us some very valuable insights. One thing that jumps out immediately when you look at that chart, pointed to in a green arrow there, is that norovirus sits very close to the top of detected pathogens in stool samples. It's consistently among the most frequently detected pathogens in these samples. And importantly, this data covers a broad time period. So it covers 2001, 2nd of January 2023, the 27th of May 2025. I don't know if that's where they finished it because there hasn't been an update since then. But you can adjust that timeline to have a look and see where these different pathogens stand. And interestingly, it covers a wide range of seasons, but norovirus, interestingly, can come up often in the summertime as well as wintertime. So it goes beyond the traditional winter vomiting bug season as it's known. So that's a key takeaway from this data set. It's circulating all year round and in volumes that rival or even surpass other major causes of gastrointestinal illness, such as Campylobacter and pathogenic E. coli strains. And this aligns really closely with the norovirus attribution study too, where norovirus was detected in fresh produce samples year-round, with most positives actually occurring during the summertime. So what this does is really reinforce that norovirus is a year-round risk, and our prevention strategies and regulatory thinking really need to reflect that. This slide really captures what I think is a major blind spot in the current system. CFAS, which is the Fisheries and Aquaculture part of DEFRA, and a government agency in the UK, is the UK National Reference Laboratory. And it's UCLAS accredited to test for norovirus and hepatitis A in fresh produce, which sounds great. But the problem is it isn't a commercial testing service that food businesses or local authorities can readily access. It's there because it has to be as part of their NRL status, not because there's active demand necessarily for routine testing by many companies. So what happens is we don't routinely test, which means we don't generate data. No data means no detections, and the risk appears low, not because it is low necessarily, but because it isn't being looked for. And without confirmed food-related cases, there's no official trigger to do anything. So lab capacity stays unused, the issue stays off the radar, and the policy loop just reinforces itself. A bit of a circular problem, and one that keeps us in a holding pattern, unless something was to break that cycle. We've talked about the lack of routine testing, but here's a real issue when someone does want to test. Where do they go to? Right now, as I've said, there's no UK lab clearly commissioned to offer norovirus or hepatitis A testing on fresh produce. Even though the NRL has the method, it's not a commercial service, and there's no plans to change that. And that creates a vacuum in the testing arena. Some labs, though, are stepping in. Labs with no food testing background, no food virology experience, and no in-lab validated methods. There's already been one case where a major retailer supplier used a non-food laboratory for hepatitis A testing because there was concerns over an ongoing outbreak at the time. Well, interestingly, I was commissioned to investigate the results from that laboratory in question and found that the controls that they used were not being used correctly, the method wasn't followed correctly, and the results ended up being completely unreliable. So that's the danger. False negatives gives false reassurance. False positives trigger unnecessary panic and a potentially serious recall and damage to reputation. So without proper training in the ISO 15216 method and relevant experience, those stepping in to take on this type of analysis could be producing very questionable results, which can be also very dangerously misleading. And this is a vulnerability. It's already being exploited. It's an emerging risk that no one really knows the size of. And for all we know, it could be happening right now, people testing these things without having the proper experience. So what can be done to control it? Well, just briefly, procedural control and physical controls are available. There's various prerequisite programs, there's guidelines and recommendations, several guidelines and recommendations available. Even in the absence of legislation specifically directed to control viruses in fresh produce and lack of regulatory requirements specifying microbiological criteria. So it's really based on duty of care, really. I would say there are very good tips on how to keep food supply chains safe currently available, which can be found in Codex Alimentarius guidelines. One of them is specifically targeted to the control of viruses in food. So, as far as guidelines go, I would recommend these Codex guidelines as the best available at the moment. So they're freely available. But saying that, it is an evolving area, and new and updated guidelines are in the works to help refine the control measures required to minimize the risks from viral contamination. So the WHO, FAO, in partnership with GEMRA, are currently producing updated statements and guidelines as well. So just to wrap things up before we leave you with a striking thought about norovirus infectivity, what I hope you've seen throughout this brief presentation is that foodborne viruses, especially norovirus, poses very significant risks in the food industry. They often go under the radar, partly because they're hard to detect and aren't regulated or monitored like bacteria are, but they shouldn't be viewed as any less important. There are targeted guidelines, such as those from Codex, and things we can do, both procedurally and physically, to reduce contamination risk. But without clear regulatory drivers, a lot of these measures remain optional or inconsistently applied. And in this case, proper training in their transmission routes, prevention and control strategies is essential at all levels. So, I'm currently providing training courses on foodborne viruses, so please be sure to keep updated on available dates. There's a lot more in the courses about the other foodborne viruses. I go into a lot more detail. This is just a snapshot. A lot of more outbreak case studies and how viruses are detected. So please take the opportunity to learn more about them so that we're all in a better position to control them through our knowledge, even in the absence of regulations. So finally, here's the answer to that question. Here's how many people might be infected by the amount of norovirus that could fit on the head of a single pin. Thank you very much, everyone.
Thank you so much, Martin. And yes, we have already a lot of reactions, which means that people stayed with us during the almost like 50 minutes, right?
Good.
And we do have a lot of questions already, so let's try to
Oh, okay.
cover all of them during the remaining time. And if you don't mind,
Sure.
Martin, I will start already without further ado.
Yes, please do.
So, how can we achieve improvements in upstream hygiene practices in primary agriculture, especially with berries? And where is the practical guidance that farmers can use?
Well, like I said, the actual guidance, I mean, most have very robust guidance in place, their own quality standards. And many use things like Red Tractor. These are followed well, the risks should be minimized. But I think where the biggest sort of improvement might be made is in the because we don't have the data really, what we might be better doing is monitoring things like irrigation water, for the presence of these viruses. I mean, at the moment, things like E. coli are used as hygiene indicators. But the problem is that E. coli doesn't give you an idea of the presence or absence of norovirus. So, it ticks a box, but it doesn't tell you if viruses are there or not. So we don't really know the potential numbers of viruses going on to produce from contaminated irrigation water. And in the UK, anyway, there's big problems. This is in the news right now with lots of huge amounts of sewage contaminated, untreated sewage being poured out into our waterways and rivers by the water companies. Illegal as it stands. It's a terrible situation going on at the moment. But all this is going into our waterways, where people are potentially using things like this for irrigation water on our fresh produce crops. So one example is to don't do overhead irrigation, use drip irrigation if that's possible. Or there's a lot of hydroponics being used now, which use more potable water, for instance. So there's lots of things that can be done, but depending on the size of the farm and how much money they have to be able to spend on control measures, it all just depends, But monitoring of irrigation water, I think, would be a good start. So we at least build up some data of the prevalence of that and see how much of a problem that is.
Thank you so much, Martin. And the good that you mentioned already E. coli, because next question is regarding this. So it starts as follows. Routine examination for hepatitis I virus seems impractical for primary agriculture. So why is it that you don't really recommend monitoring for E. coli? We have used that simple and quick test to give an indicator of fecal contamination for many years.
Yes, because like I say, it just does not indicate the presence of viruses. You'd think it would, but it doesn't. In that study that I mentioned that took place in 2015 to 16, we did about 1,200 samples of fresh produce, and we analysed them for norovirus, but we also analysed them for E. coli as well. And I think out of one of the contaminated ones that we got for virus, one of them correlated with an E. coli result, but all the others didn't. So it doesn't really tell you anything. It kind of goes against logic because it's fecal contamination. You'd think it would, but actually it doesn't really tell you anything.
Okay, thank you so much. And what are the best approaches to build up public awareness in food viruses?
Well, what we're doing now, things like this, exposing the area to lots of people worldwide. The training of people. I think training is the biggest one because knowledge is power, and if you are able to get that knowledge across and let the people who are on the fields understand that, isn't it? It's great having technical managers to do this training and directors and all the rest of it, but the people at the front line of that handling of produce, or the farmers or whoever, need to know that risk as well. So if they're unaware, that's where it can creep in and it goes under the radar. So if someone's unaware that when they go to the toilet and they don't wash their hands properly, although you'd think people would know this, that's a problem. And especially when as I say, when it comes to asymptomatic people as well, who don't even know that they're ill. So just the extreme importance of good hygiene whenever anything like this is, any produce is touched, by the human hand. But like I say, even improper glove use can be just as bad, because if the fruit is contaminated, the gloves just contaminate all the other things after it cross-contaminates as well. So there's no easy solution to it, but just raising awareness of it, getting the people on the ground who are actually, harvesting these products and irrigating them, I think is the most, and training them properly in the risks is most important.
Thank you so much, Martin. And next question comes about organic acids, for example, such as citric. Are they really effective to remove or kill food viruses?
Well, it's an interesting question for sure. I mean, there's been lots of studies on different types of disinfectants and other natural substances on viruses. I think what I would say at the moment is that the data that we've got is mostly performed on surrogate viruses. That's because norovirus can't currently be routinely cultured in the laboratory. They're almost there with the ability to do that, but until they have standardized that and it's routinely available, we have to rely on surrogate viruses. So this is viruses that are similar in size and characteristics to the target virus, like norovirus or hepatitis A. So currently, it's just a best guess when these things are being tested on the surrogate viruses. So you have
Yeah.
to bear that in mind, that there's no definitive, well, actually, yes, that surrogate virus is definitely doing what norovirus would do in this situation. So any papers that you see or whatever stating this, you just have to bear that in mind. Are they testing it against the actual virus, or are they testing it against a surrogate virus? So yeah, it's a good question.
Thank you so much. And next question comes about regulations. Would they be really effective? Because I think it's similar to Salmonella, Campylobacter, etc. Not really
Mhm,
effective, just for verification. Like control is needed,
mhm,
but monitoring is relevant, by the way. Like,
mhm.
what's your opinion on this?
Um, I think if you don't change anything, nothing will change. You know, it's simple as that. If you don't look for it, it's, you know, those figures that I put up there, they're shocking, you know, statistics. So are we happy with that? To just go on without doing anything? No control measures, nothing, no criteria. Don't we want to try and do something about it? You know, are we, I mean, are the people who put the policies happy about this? You know, that there's nothing, you know, these statistics that we're talking about here. I mean, they're not good. They're not good to look at. So why, if we can do anything to minimise it, why don't we try and do that? You know, and I think in terms of uh, being able to minimise risk, at least monitoring of these things, not necessarily saying, you know, if you detect a norovirus or hepatitis A in your salad, you have to destroy the whole salad crop. That's not what we're suggesting, but at least we could build up, um, you know, over time, data to show where hotspots are for problems or where difficulties might be seen on different farms. You know, at the moment, we don't know if anything imported is coming in with norovirus or hepatitis A. It's already causing outbreaks. Are we happy for that to continue? Is what I would say, without anything in place to prevent it.
Yeah, probably it was a provocative thought. Definitely. Another question comes regarding slide, if I'm not mistaken, it was your slide 31 on IID 3, where is graphs, and it was like a substantial prevalence of, yeah, this one, DAC and
Yes.
EPIC. So wouldn't there be a possible sentinel for hepatitis A, given that both E. coli and hepatitis originate from human fecal?
Um, I'm not quite sure I understand the question, but in terms of this, this is so these are collected from stool samples presented to general practice clinicians. So they then get tested for all these different bacteria and viruses there. There's a few different viruses there. So they're not indicators of anything that's happening on farm or in produce. This is just indicating what's in people's um, intestines at the time that they are tested. But I'm not sure quite what the question is related to that. Sorry.
Yeah,
I can
yeah,
always answer it.
I just now also send it to you in private, so like maybe I just read it out loud, not really
Oh,
correctly.
okay.
So wouldn't there be a possible sentinel for hepatitis A, given that both E. coli
No,
and hepatitis? Yeah, no.
no, unfortunately not. Again, there needs to be more studies into what would really be a good sentinel or index virus to use for this. I mean, there has been talk of using things like crasphages, which are, um, you know, in your body and you know is able to be much easier detected in terms of being able to um, grow them and you know make them reproduce in the laboratory. Um, so again, until that time comes that we've got a decent norovirus culture system, we'll be able to validate this. You know, we might be able to find that something is a very good indicator or sentinel for norovirus that we don't currently know yet. I don't think we're that far away from answering that question. But at the moment, with the knowledge that we have, there isn't anything really currently available reliably
Yeah,
that does that.
okay, thank you so much. If you don't mind, I will steal a bit of your time because we still have some more interesting questions to answer.
Yeah, it's
Uh,
fine. It's fine.
Perfect. Next one is like, what extraction protocol should be used for ready-to-eat meals since none is described for this type of matrix in ISO?
Yeah, absolutely true. There is none for multi-component foods like these things. You know, if you know the component that might be contaminated or be the most risk of being the contaminant, um, then that might be able to be taken out of the product and tested. But if it's a multi-component food, which is that your question? Is it? If it's a multi-component food, that just doesn't exist. At the moment, for the date samples, I was able to detect the hepatitis A virus on those medjool dates during that outbreak in 2021 when I worked in the laboratory at Camden BRI, and the method worked for that, even although it was out of scope of the ISO method. So the scope of the ISO method is basically for soft berry fruits, leafy green vegetables, and bulb vegetables. That's all. If it's outside of that, it hasn't been validated for. So that's just the limitations that we have, unfortunately, of this particular method. It might get better. It'll probably get better over the years, but at the moment, that's what we're limited to.
Thank you so much. Next one is actually a very interesting question as well. Since noroviruses are known to be transmitted through the fecal-oral route of contamination, are food service facilities in the UK required to have an employee illness policy that require employees to disclose if they are experiencing symptoms like vomiting, diarrhea?
Yeah, for sure, yes, and that's not just for norovirus; it's for all sort of any symptoms that might be associated with either bacterial food poisoning or virus food poisoning. Like I say, the biggest risk is those who aren't showing symptoms. But yes, the UK does have that policy in place. So the policy is that they mustn't handle food or actually be in the workplace where food is being handled and not come back to work until 48 hours after the symptoms have disappeared. That's the current. Although actually, I didn't show it in this slide, but shedding of norovirus, for example, in someone who has had the infection can carry on for many weeks after the symptoms have disappeared, which is why thorough hand hygiene is very important.
And the last question probably for today would be about vaccination of the staff. Are there any specific required list or like maybe procedure, etc.?
No, there's not. Like I say, hepatitis A vaccine has been around for many decades. I had it because I used to work with hepatitis A in a laboratory. So if you're at risk, maybe of contracting it in a laboratory setting, or if you're traveling abroad, obviously you might be going to an area where it's endemic. You can get that done through your GP surgery. But there's no requirement for food handlers anywhere, as far as I'm aware, to have a particular. Hepatitis A is in the news all the time in the US because they have lots of food handler related issues related to hepatitis A outbreaks on food service workers. But no, in the UK anyway, that's not the case.
As far as I don't see any more question here, probably it's time for us to kind of summarize for what we discussed today. And it was really an amazing topic, especially in terms of current vacation. So guys, just be safe and take care of yourself. And I'm looking forward to see you at our next session. Will be already 12th of August. I just dropped the link in the chat so you can register already. And thank you so much, Martin, for sharing your experience with us.
Oh, you're welcome. Absolutely welcome. Thank you very much, everyone, for your attendance today. Appreciate it. And to you, Alina.
Thank you so much. And recording, as always, will be published tomorrow on our LinkedIn page and sent to all attendees privately via email. Stay safe and goodbye.
Bye, everyone. Thank you.